improving the behavior, but we want to lean in and ask what's going on with you as opposed to what's wrong with you.
Your seatmate there, Dr. Kevin Chapman, who's also been a part of our discussions about youth mental health and other issues concerning mental well-being. Thank you, Dr. Chapman, for joining us. We appreciate it. Since you do specialize in anxiety and anxiety-related disorders, what are you seeing now that's different during this COVID era that was not necessarily prevalent before?
Yeah, well, thank you for having me again, Renee. It's always a pleasure to be here. It's interesting. I think that the other guests and panelists who've been on the show have said a lot of really good things. There's been a wealth of information already shared. And I think what I'd add is that, one thing that COVID has triggered is this sense of uncertainty. And I think if you think about uncertainty, uncertainty is literally the sibling of anxiety and worry. So ultimately, anytime we have a sense of uncertainty about what could happen, how long this will last, what that will look like, when I can socialize again, re-enter society, et cetera, uncertainty inevitably is going to trigger anxiety. And what I've told people in the past, particularly journalists, is this idea that it's not so much that the current clients that we see for anxiety and related disorders are struggling per se, it's that COVID has tipped, if you will, the new cases of anxiety. So we see a lot more cases of anxiety. So the people who had these predispositions to be anxious, so to speak, who may not have been yet, COVID has really triggered that and tipped, if you will, to use a Malcolm Gladwell term, people to have these anxiety and related symptoms. So we see a lot of that these days.
Right. It exacerbates a lot of things, and that makes perfect sense. So what are some strategies, coping strategies that you give parents and kids and families to help them with their bounce back ability and their resilience?
Well, Renee, I think that to keep it simple, there was an acronym that I developed around the time of COVID that I think that could be really useful, and it's very simple to remember, and it's called Fight COVID. And that acronym of Fight COVID is a way to really think about some practical strategies that are largely mindfulness-based science, cognitive behavioral science, which is the gold standard treatment for anxiety and related disorders. So to break that down quickly, fight. So the F is to teach your child, but also as a parent, to focus on what you can control. We can't control how long the pandemic will last. We can't control what may or may not happen in the future, but we can focus on our present, right? So we can see what's happening around us, ground ourselves in the present moment, and focus on the things we can control. The I is to identify negative thoughts. Negative thoughts fuel the fire to strong emotions. And though COVID triggers normal, adaptive, healthy emotional responses, anger, anxiety, sadness, etc., those are all adaptive emotions. But I think that when we have negative thoughts that are unrealistic in nature, it fuels the fire and exacerbates those emotions, if you will. So identifying those thoughts that are adding fuel to that emotion is a really important next step. Next is the G, and the G is to generate flexible thoughts. See, Renee, it's not about just being positive. There's a lot of things right now that aren't positive. It's about being flexible, being able to generate different ways and perspectives of viewing what's happening right now. That's the key to what one of our panelists said earlier, to self-regulation or emotional regulation, is being flexible, not being right, so to speak. And then the H is, and I love the families you showed earlier and showcased. Ebony was a good example of H, which is highlighting adaptive behaviors, being able to engage in good self-care, being able to engage in exercise and fitness regimens, and so on and so forth. And then finally, my favorite, Renee, is teach someone else the same thing, the T. So being able to help other people be flexible, be mindful, identify these negative thoughts, focus on what we can control, and then teach someone else the same thing so we can help each other in our community.
Oh, that's a perfect acronym, FIGHT. I think we can all remember that. Thank you, Dr. Kevin Chapman. I want to go back to our Frankfurt studio, and I want to ask Ms. Carol Ann Morrison.